Of discussion for now is alcohol induced esophageal disorder. So the topic that we'll go through this topic. Initially we'll look toward all these things, right? Under this we'll be talking about mallory weiss boerhaave syndrome. We'll be talking about all these things, and finally what we'll do is we will just correlate our these things with the content mentioned in our Robbins. So this much, and let's begin the discussion. Now here initially the thing that we need to know is what is the meaning of lacerations, right? What is lacerations? Laceration is simply a wound, right? Wound that involve tearing of soft tissue, right? Laceration is the wound that involve tearing of soft tissue. Right now we are talking about what? Alcohol induced one, right? Okay. Alcohol induced one. There are two conditions, right? One is mallory weiss and another is boerhaave syndrome, right? Now talking about difference between this mallory weiss and boerhaave syndrome, what we need to understand is that this mallory weiss syndrome, right, it is superficial tear, or it is just confined within superficial region. But this boerhaave syndrome, it is deeper, or it is more severe than our mallory weiss tear. So mallory weiss, there is the involvement of our mucus, right? There is the involvement of our mucosal layer, right? Mucosal layer, and so we are calling it as superficial. But in the case of boerhaave syndrome, it from B we can just make acronym that is BAD, right? It is more bad. Bad means it is severe, right? It is more severe than our mallory weiss syndrome. And why it is severe? Because it involves muscle, right? It involves muscular layer, and here the muscle is being ruptured, right? But in the case of mallory weiss, there is only the involvement of mucosa, right? Now talking about the location of this mallory weiss tear, it is located just below our gastroesophageal junction, right? Just below gastroesophageal junction in the case of 90% case. But 10% cases, what we'll find is we'll find the location of this mallory weiss syndrome, right, in the lower part of our esophagus. Now talking about boerhaave syndrome, what we have is that it is present, right, on the lateral part of left side, right? On the lateral part of left side, as you can see, it is present on the lateral part of left side, right? And it is present above gastroesophageal junction, about 3 to 5 centimeter above our gastroesophageal junction. So we talked about two differences till now. The one is in mallory weiss tear we have the involvement of mucosa only, right? But in the case of boerhaave syndrome, we have the involvement of muscular layer also, right? We talked about location of mallory weiss tear that is below gastroesophageal junction, but boerhaave syndrome is above, right, gastroesophageal junction, that is 3 to 5 centimeter above, right? We said that mallory weiss syndrome is not that much severe, but boerhaave syndrome is more severe, right, more complicated. Okay, talking further about boerhaave syndrome, what we can know is that this our boerhaave syndrome, right? Boerhaave syndrome, in the case of boerhaave syndrome, we'll talk about the clinical features, right? The clinical features related with boerhaave syndrome. Now talking about the clinical features related with boerhaave syndrome, we can have a triad, right? And this triad includes our includes the first one is our chest pain, right? The first one is chest pain, right? Chest pain. And the second one is, what is our second one? The second one is, as you can see right here, the first one is our chest pain. The second one is our hematemesis, right? Vomiting, or we can say vomiting, right? Hematemesis or our vomiting. And what is our third one? And the third one is our subcutaneous emphysema. What is the third one? It is subcutaneous emphysema. Okay, now what is this triad called, right? This triad includes the clinical feature of our boerhaave syndrome, right? Okay, now what is this triad called? This triad is called Mackley's triad. What I'm saying is this is called our, what is this called? This is called our MACKLE, yes, Mackley's triad, right? It includes the clinical feature of our boerhaave syndrome. One is our chest pain, another is our vomiting of blood, and that is hematemesis also. Another is subcutaneous emphysema. Now what is this subcutaneous emphysema? There is another important thing that we need to know. right? This subcutaneous emphysema, right, since we said that in boerhaave syndrome there is involvement of muscle, there is the involvement of muscle, there is what, there is the puncturing of muscle. So what will happen here is this the ear will enter into what, enter into our tissues, right? And as the ear will enter into our tissue, we are telling it as what, subcutaneous emphysema. And as that as that ear enter into our tissue, right, in the region of our esophagus, what will happen, if we'll just auscultate that area, we'll hear crunching sound, right? We'll hear what, crunching sound, right? Crunching sound. And this crunching sound is given a special name, and that is Ham's crunch. What is that called? H-A-M-M-A-N-S, Ham's crunch. Okay, so it is so important. So we talked about what, we talked about chest pain, we talked about vomiting, that is hematemesis, and another we talked about subcutaneous emphysema, right? We talked important crunch, that is our Hammond's crunch, right? Hammond's crunch. This is so important. Now moving forward, right, okay, now we're talking about hematemesis. Hematemesis is painful, right? It is important to mention painful right here, because there is another condition, that is painless hematemesis, right, which is seen especially in the case of esophageal varices, right? Varices. We'll talk about these things later on, but right now what we need to keep in our mind is the esophageal varices is what, the esophageal varices has a clinical feature, that is painless hematemesis, right? It is mainly because of what, portal hypertension, right? Portal hypertension that results liver cirrhosis. So what we talked till now is, we talked about mallory weiss tear, we talked about boerhaave syndrome. Okay, these are the most important fact that we need to know, right? And whatever we talked about, whatever we talked about this Mackel-Stride subcutaneous emphysema, right? And these are what, these are very high yield for competitive exams. So okay, now here this much for our what, this much for our this note part. Now let us move toward what, let us move toward our Robbins. Now if we just see Robbins, okay, in Robbins it is mentioned in laceration portion, right? You can see right here mallory weiss tear. Now what is this? Longitudinal mucosal tear, right? Involvement of mucosa only. Mucosal tear near gastroesophageal junction, yes, we talked about its location, right? Are more often associated with severe retaching or vomiting secondary to acute alcoholic intoxication, right? It will cause because of what, because of alcoholic intoxication, but it is the secondary factor. Okay, now moving further, right, normally a reflux relaxation of gastroesophageal muscular pressure, the antiperistaltic construction wave associated with vomiting. Okay, it is mentioned about all that thing only. Okay, now you can just see the clinical features associated right here. You can see okay, right here. Now moving further, what we have is, we have boerhaave syndrome, right? It is much less common but more serious, as we have already mentioned, right? It is characterized by what, it is characterized by transmural tearing. That means it involves what, rupturing of our muscle layer also, right? Muscle layer also, right? Now here you can see the clinical feature that the patient are seen with. Now here I would like to mention about this table. In this table we have what, laceration, which is written what, mallory weiss syndrome, and we have esophageal perforation, right? Esophageal perforation means what, perforation, right? Perforation within muscle layer, and that is that includes what, boerhaave syndrome, right? And these things, these other things, we'll be talking about these other things in later lecture. So this much for right now, which you are clear about what, mallory weiss and boerhaave syndrome. So next chapter that will be next topic that we'll be discussing is, we'll be discussing about achalasia cardia.